Hi there, welcome to Bloom. Today we're going to study about the cranial nerves. We all have 12 pairs of cranial nerves, which are attached to the underface of the brain, extending from the brain stem. Their fibers contact and pulses between the brain and the structures in the head and neck and in the thoracic and abdominal cavities. So we're going to study each of it. Let's go. Our first cranial nerve is the olfactory one. It comes from the nose to the brain, and the main function is the sense of smell. The second one is the optic, which is responsible for vision and comes from the eye to the brain. The third one is the oculomotor. It comes from brain to eye muscles, and the main functions eye movements. The fourth one is a trochlear. It comes from brain to external eye muscles and it's responsible for eye movements too. The fifth one is known as trigeminal. It comes from the skin and mucous membranes of head and from tree to brain, also from brain to chew and muscles. It's responsible for sensations of face, scalp, and teeth, chewing movements. The sixth one is known as abducens, from brain to external eye muscles, and is responsible for eye movements. The seventh one is the facial one. It comes from taste buds of tongue to brain, from brain to face muscles. It's responsible for sense of taste, construction of muscles, of facial expressions. The eighth one is the vestibulocochlear. It comes from ear to brain and is responsible for hearing, sense of balance. The ninth one is the glossopharyngeal. It comes from throat and taste buds of tongue to brain, also from brain to throat muscles and salivary glands. It's responsible for sensations of throat, taste, swallowing movements, secretion of saliva. The third one is the vagus. It comes from throat, larynx, and organs in thoracic and abdominal cavities to brain, also from brain to muscles of throat and to organs in thoracic and abdominal cavities. It's responsible for the sensations of throat and larynx and of thoracic and abdominal organs, swallowing, voice production, the slowing of heartbeat, acceleration of peristalsis. The 11th one is the accessory. It comes from brain to certain shoulder and neck muscles. It's responsible of shoulder movements, turning movements of head. And the last one is the hypoglossal. It comes from brain to muscles of tongue and is responsible of tongue movements. Thank you for watching. Bye-bye.